When a child's first teeth erupt, the new enamel is highly susceptible to decay. Sugar left on these fresh surfaces rapidly accelerates cavity formation. To counter this, Kalrav Hospital developed the Pediatric Oral Health Awareness Initiative. Led by Dr. K.G. Gupta, this clinical protocol corrects a common dangerous assumption among parents, that daily brushing can wait until a full set of primary teeth appears. Waiting allows decay to establish a foothold early. Protecting the future structure of an adult mouth requires stepping in exactly when the first tooth breaks through the gums. That moment is ground zero. You should begin a brushing routine the day you see that first tooth, usually around 6 months of age. The specific hardware you use is flexible. Both manual and powered toothbrushes are highly effective, provided they meet 2 strict criteria. First, the bristles must be soft. Second, the brush head itself must be small enough to navigate an infant's mouth comfortably. This tool needs regular replacement. Swap the brush for a new one every 3 to 4 months, or immediately if you notice the bristles beginning to fray. Applying properly scaled equipment at this early developmental milestone gives you the mechanical advantage needed to stop early childhood decay. But mechanical brushing alone isn't enough. You need fluoride. This essential chemical agent actively strengthens developing enamel and prevents cavities from forming. The concentration of fluoride must match the child's age. From birth to 6 years, look for toothpastes with at least 1,000 parts per million. Once they turn 6, move up to a standard family toothpaste containing 1,350 to 1,500 parts per million. Because infants cannot reliably spit, the dosage must be strictly limited. For children under 3, apply a smear of toothpaste no larger than a grain of rice. Between the ages of 3 and 6, that measurement increases slightly. At this stage, you will use exactly a pea-sized amount. Throughout these years, never let a child eat toothpaste directly from the tube, and actively encourage them to spit rather than swallow the paste during brushing. Treat fluoride toothpaste as a localized medicine. By carefully measuring the dose based on age, you fortify the teeth while keeping the child entirely physiologically safe. With the right paste measured out, the success of the routine relies entirely on your technique. Aggressive scrubbing damages gums, precision clears plaque. Place bristles against the teeth and tilt to a 45-degree angle pointing toward the gum line. This targets the sulcus, the pocket where bacteria gather. Maintain this angle using gentle, circular, or short back-and-forth strokes. Let the bristle tips dislodge the particles. You must methodically clean 3 distinct zones: the outer surfaces facing the cheeks, the inner surfaces facing the tongue, and the flat chewing surfaces. Once the teeth are clear, finish the routine by gently brushing the surface of the tongue to remove trapped odor-causing bacteria. Meticulous angulation and systematic surface coverage easily dismantle bacterial networks without the need for brute force. To be completely effective, this cleaning routine must be performed twice a day for exactly 2 minutes each time. While the morning session after breakfast is important, brushing at night before bed is critical. It removes the day's plaque and creates a prolonged window for fluoride to repair enamel while the child sleeps. Adult supervision is an absolute requirement for every session. You must actively monitor the process until the child demonstrates the precise motor skills needed to spit out the foam effectively on their own. Even the most scientifically sound brushing technique only prevents cavities when backed by the rigid consistency of a closely supervised daily regimen. Clinical oversight is the final layer of protection. Schedule your child's first dental visit by their first birthday, or within 6 months of their first tooth appearing. At home, you must limit sugary snacks and drinks between main meals to prevent continuous acid attacks on the new enamel. The entire protocol comes down to 4 simple steps: small brush, small paste, twice daily, lifetime healthy smile. Adhering strictly to these age-based guidelines protects primary teeth and ensures the structural integrity of the permanent teeth that follow. By taking action early, you fulfill the core mission of Kalrav Hospital. We care, nature cures.